I will prescribe regimens for the good of my patients, according to my ability and my judgment, and never do harm to anyone. Known as the Hippocratic Oath, these words have been sworn by doctors for centuries. Of all healthcare professionals today, only physicians and nurses take an oath to put patients first. It may be a contributing factor in a recent study that found patients had better outcomes at hospitals owned and operated by physicians.
Physician-owned hospitals, we mostly specialize in one type of care and take great pride in providing that care to a higher level than what we would do at a community hospital.
We started this movement in the 1990s to get back to that relationship to provide quality care between the patient and the physician.
Studies have shown that infection and mortality rates are lower and nurse-to-patient ratios are higher in physician-owned hospitals.
There's actually been numerous federal studies done that actually look at quality measures, complication rates, morbidity rates, all of these in an effort to show that physician-owned hospitals have done what they've said they should do, and that's provide outstanding care better than the benchmark.
Healthcare industry analysts believe that in many cases, critical care decisions are being made by insurance companies or hospital administrators with little or no medical training. Organizations such as Physician Hospitals of America are dedicated to improving healthcare by putting medical decision-making back in the hands of physicians and nurses.
We believe that the frustration levels for both the doctors and our patients is becoming increasingly high. And one of the ways to solve that is to eliminate the gap or the distance between the patients and the physicians who treat them.
In an effort to fix this, I think physician-owned hospitals have actually moved towards providing this care in a way that's both beneficial to the doctor and to the patient. We do feel that it's a better model.
When a practicing doctor is directly involved in every aspect of patient care, as they are at hospitals owned by physicians, patients can benefit by having the opportunity to play a more active role in their care.
The doctors I've had in the past haven't really helped me, and I feel like I was being rushed by them. The doctors here helped me tremendously. The staff here was friendly and warm and always here for me and my family.
Physician-owned hospitals are helping to serve an unmet medical need throughout the nation by providing access to high-quality medical care in rural and underserved communities.
It's much better having a physician-run facility because in a general hospital, their administrators, they're non-medical personnel. They don't get the full picture of the patient. They're looking mostly at dollars and cents. Here at a physician-owned hospital, the patient comes first, always.
Our hospital is in an area that was pretty much not utilized for healthcare in the past. And other facilities are doing the same thing. By that way, we're allowing access to care to be expanded and also to make the care that you do access better.
Many doctors believe that practicing in association with a physician-owned hospital is ultimately more satisfying and more akin to practicing medicine for the reasons they entered the field.
I enjoy working at the physician-owned facilities because all the decisions are made by medical personnel, doctors, nurses.
I find it extremely fulfilling to work in a physician-owned hospital as opposed to community hospitals. It allows me to provide outstanding quality of care to my patients on a daily basis without limitations that I would have normally had in a community hospital setting.
Facilities in general are smaller, so it's a more intimate relationship with the patients, the physicians, the patients' families, and the employees.
Some argue, though, that physician-owned hospitals provide unneeded competition in healthcare. However, studies have shown when a hospital owned by physicians opens, other hospitals in the community often respond by improving their own performance.
I believe that physician-owned hospitals actually have an essential role for the future. I do believe that we are providing healthcare reform. We are providing quality care to patients in a way that's not hindered.
We believe that we will be more attractive overall in an economy where it's important to be very efficient.
Imagine that you're about to have surgery, but instead of a skilled surgeon deciding what quality instruments, medications, or equipment will be used, those decisions are made by a non-medically trained administrator. That's why hospitals owned and operated directly by doctors are becoming known more and more for offering all patients the highest possible quality of care.
I think the goal for a physician-owned hospital is to provide outstanding care in a way that can't be paralleled in community hospitals. It's better quality, lower mortality rates, better service by the staff, and overall a better experience.
Study after study has shown that patients receive far better care at physician-owned hospitals. From coast to coast, patients at hospitals operated by physicians themselves report satisfaction over 98%. Complication rates at physician-owned hospitals are significantly lower than at general hospitals. Nurse-to-patient ratios are higher, while the risk of infection is lower. And in many cases, the cost for some of the most common procedures is less expensive than at non-physician-owned hospitals.
The type of care that's delivered at a physician-owned hospital is excellent in many ways simply because physicians have direct control over administration as well as the way that care is delivered. We have direct input both on the floor level as well as the administrative level to make sure that every aspect of the care is excellent.
My procedure went very well. I feel much better, and it's very possible I might have to have another surgery, but this is where I will come. I was very impressed with the staff. They were very attentive. They were very caring. It was very personal. Very personal.
There are some 200 physician-owned hospitals in the country, with another 85 hospitals scheduled to open soon. In addition to pace-setting quality care, these hospitals generate a huge positive impact in their communities and across the country. Over 55,000 full and part-time jobs, $2.4 billion in total payroll, $1.9 billion in purchasing, and instead of needing tax money to operate, physician-owned hospitals pay more than $509 million in federal taxes alone. Physician Hospitals of America is helping to reform healthcare one hospital at a time by putting the control of medical facilities back where it belongs, in the hands of doctors, nurses, and patients. After all, physicians took an oath to put patients first. Visit physicianhospitals.org or call the number on your screen.